Hey there guys, Alex from Mental Health Thinking here. I'm a provisional psychologist and all the things I say in these videos are just things that I tell clients. Today I want to talk about OCD or Obsessional Compulsive Disorder. Some of the myths that surround it, what it really is, and of course, as I always talk about in my videos, what kind of cycles can lead to it and how we can cut those cycles off. So OCD has become a bit of a buzzword for when people say line things up in a certain way and they want them to be even, or they want balance in perhaps the feeling of stepping on one foot to another. Sometimes people want things to be just right, they want them to be spot on, and they talk about that being their OCD, so it's another one of those myths as well. OCD diagnostically is the combination of two things: obsessions and compulsions. So an obsession is a fixation on one particular thing. It needs to be persistent and that you can't seem to shift your mind away from it. People with OCD are tortured by these obsessions and they try to ignore them to no avail in their case. Because of how important the ideas are to them, and I'll talk about why that is in a moment, but also because when people really want to get rid of a thought, when they find something distressing and then they try to push it away, as I talked about in my video on mindfulness, it actually makes the thought more rampant. So the other side is compulsions, and they're things that we actually do. They're behaviors that people with OCD would use in order to try to decrease the obsessional thinking that they have and try to decrease the anxiety that they have because of it. So these compulsions are often repetitive because they have those obsessional thoughts going on constantly. So they'll go back and try to get rid of them over and over again with certain rituals. And it's important to note that these rituals are generally not actually linked very well, at least in the end, with reducing their anxiety. All of this will start to make sense when I talk about the formulation. When I talk about OCD to somebody who hasn't experienced the symptoms themselves, I generally talk about behaviors that we all have from time to time. So let's say that you walked away from your house, you weren't 100% sure that you'd locked the door. So you think, okay, I could go back now and I could check, or I could just keep on going. Maybe you go with the second option and you think, oh, okay, well, I'm kind of fine with it, I'll just keep on going. I'm not that worried about that uncertainty. But what if you had all of these thoughts that if you didn't lock the door, then somebody might break in, somebody might steal your things, somebody might hurt your loved ones. All those sorts of things make it more significant. So even if you're just a little bit unsure, you'll still go back and check because of all those concerns. People who have OCD, by the way, tend to have flashes of terrible things happening to their loved ones and whatnot if they don't do certain types of checking behavior. And that's an example of one where you might have seen in movies where people have rituals around locking and unlocking a door 5 times because that makes them feel more sure that it is locked. That behavior usually comes from the idea that if they don't lock it, something awful is going to happen in the first place. So let's say that you do go back and check. So then you've reduced that uncertainty by going back and compulsively checking. Then you might walk away, you go back into your car. There's still some degree of uncertainty. Even though you've just checked, there's still some uncertainty, some small amount left that the door is still unlocked. Now usually that's completely fine. You think, okay, look, I'm sure that I've done it this time. I did just go back just with the task of doing it. But what if you're still having those flashes in your mind of terrible things that might happen? Then maybe you go back again and you just check it again just to be sure. That can happen over and over again, and over time, that feeling of uncertainty becomes so debilitating and so uncomfortable that you might form rituals around it because you decide that if you've made sure that you've locked it a certain amount of time, or that you've done it in a certain way, or maybe that you've done other things that make you feel sure that the door is definitely locked. Maybe there's 5 locks. It could present in a whole array of different ways. But the main thing is, in the end, you are doing something, a compulsion, to get rid of the feeling of uncertainty that comes from the obsession about, in this case, locking the door. Now, locking the door is just one example. It could be any number of things. In really significant cases, people can start to think that the thoughts themselves that something bad might happen to a loved one could actually cause it. And that's just another thing, apart from the flashes of what might happen if you don't compulsively act. If you are having those negative thoughts, they become more significant because you really don't want to have them if you think that the thoughts themselves could actually cause bad things to happen themselves. So you do everything you can to avoid those thoughts. That means you get more into the compulsions. And that means that those thoughts become something that you more try to push away. So in therapy, of course, we tend to do the opposite. But first things first. First, we need to prove to the person that there isn't really a link between the thoughts that they're having and bad things happening. We also need to, over time, help somebody to realize that if they don't check, that it'll still be okay. That maybe it is getting more comfortable with that feeling of uncertainty that comes around not being 100% sure that the door's locked, for example. So you can do that, and that tends to be part of the origin, especially in cases where people are thinking that the thoughts themselves are actually going to cause bad things to happen. But what's happened over time is, through avoidance of that feeling of uncertainty, they become less and less able to deal with it. You can think of it as something that we have to resist. That feeling of uncertainty that we'll all have on a daily basis, we just have to deal with it. And if we don't deal with it, we're not flexing that muscle of dealing with it, so to speak, and we get worse and worse at it. So that feeling becomes more and more powerful over us. So treatment for it is difficult for the person in general, because it involves going back and rehabituating to that feeling of uncertainty. So of course, not using that checking behavior as much and decreasing that in stages over time, but you might want to distract yourself when you're doing that, or do something else that keeps your mind off it. All that sort of thing that people do to make it easier at the time. But what you're doing when you do those things is actually avoid in some other way the feeling of uncertainty. Now, it's still going to be somewhat beneficial to habituate to not doing those compulsive tasks, but we need to get used to that feeling again of uncertainty. So you've got to seek out cases in which you get that feeling. Perhaps not distract yourself. Perhaps if you find that you're more comfortable when somebody else checks it, make sure that that's not happening. And you can build up to this in stages. There's all these different ways of making sure that you're actually less comfortable. And it sounds totally bizarre to try to do this on purpose, but being less comfortable is something that you need to get used to in order to be okay with that feeling of uncertainty over time. Okay, that's it guys. That's my video on OCD. I hope you've enjoyed it and you've got something out of it. If you did like it, press like there. That just makes it more likely that other people will see it. And if you want to see more, I make them every week. Hit the subscribe button. Thanks.